Greetings, my name is Jeff Meeks.
And I'm Tavius Stargell.
We are students at Hillsborough Community College, spring of 2021, Anatomy and Physiology 2 lab. Professor Corey Hoch is our instructor. And this is our research project. We've been given a scientific published article to break down and offer a little insight and information on. And our article is entitled Chronic Traumatic Encephalopathy, Neurodegeneration Following Repetitive Concussive and Subconcussive Brain Trauma, right? Also known as CTE. So I'm going to present part A of our project, and Mr. Stargell will present part B. So part A, what is CTE? Chronic Traumatic Encephalopathy is a degenerative brain disease found in individuals with a history of repetitive brain trauma. That's what CTE is. Interesting note about this article, it's dated May of 2012, so it is about 9 years old as of this date. And what's interesting is that the information that was used to present and gather insight on CTE was gathered from over 70 retrospective clinical exams that were conducted on individuals who had been diagnosed with CTE and had passed away. So these researchers and physicians and doctors, they returned to those cases, in many cases had to gain permission from the family, and they had the brains and the tissue of those individuals donated to them so they could reevaluate and restudy this thing called CTE to see if they could offer additional insight. What's interesting about CTE as of the date of the article published was that the condition could only be diagnosed post-mortem. A living individual, they did not have the markers and the wherewithal to diagnose a living individual with CTE, so the individual had to pass, then the autopsy would be done, and that's when the condition could actually be diagnosed. Mr. Stargell will be presenting an interesting update on that point in just a few moments. Well, according to the article that we were given, the researchers were able to narrow down the symptomology of CTE and categorize it in two divisions. The first being the neuropsychological and neuropsychiatric symptoms. These were the traits of the individual while they were living that had to do with their mood and behavior, their cognitive ability, and these were common symptoms included memory impairment, depression, suicidality, irritability, apathy, anger outbursts, etc. That was on the neuropsychological and neuropsychiatric side. As well, the second division of symptomology had to do with the neuropathological. This had to do with the findings of the tissue, specifically the brain and cranial area that they would find post-mortem. More specifically, brain atrophy, the accumulation of tau protein, tissue degeneration, neural loss, etc. These were the physiological findings of those examinations. So what they found were that the symptoms related to CTE specifically pointed to the effect, the direct effect that repeated head trauma had on those individuals. And according to the article, that allowed us to change our approach to these individuals both while they were living and as well change our approach to the sports and the conditions that cause CTE. A little bit of history of CTE, how CTE came to be known as CTE. Well, CTE falls under the heading of traumatic brain injury, TBI, and that's been around for centuries, dating back to ancient Mesopotamia, where archaeologists would find skulls, the remains of soldiers on battlefield sites that had not only signs of traumatic brain injury, but as well primitively drilled holes where the physicians of the area had attempted to treat those injuries at the time. And for centuries, we see the documented findings of the physicians and doctors over hundreds of years that documented not only the symptoms that individuals would exhibit while living that were directly tied and related to brain injury, but as well their attempts, often primitive, of treating and correcting such conditions. And so in the 16th centuries, when we see the term concussion used medically from then on to refer to a traumatic brain injury and the effects thereafter. And it was not until the early 1900s, 1920s, where the research and the findings of traumatic brain injury got more focused and specific, particularly in regards to the study of boxers. Over their careers, they began exhibiting symptoms and behavior that they were able to categorize and show that it was the result of not just a single severe concussion or blow to the head, but it was the result, the accumulated result over many years of repetitive blows to the head. And so one of the sources that was used for our project was a published research article out of California. Dr. Craig Lindsley, his article CTE, A Brief Historical Overview, shows that it was 1949 that the term CTE was coined to refer to the condition from repetitive blows to the head over time, where symptoms would not manifest sometimes for years after the individual stopped boxing. So what we see with CTI was that it was different from the other conditions because it was repetitive. And that brings us to our current era of CTE, where my colleague, Mr. Stargell, will take over.
Yes, thank you, Mr. Meeks. So in our current era today, there's a spotlight of one particular doctor in particular, Dr. Bennett Amulu. Now, who is Dr. Bennett Amulu? Well, Dr. Bennett Amulu was one of the first to identify and name the chronic CTE as a disease entity in football players and in wrestlers. Dr. Amulu was the first person to discover physical evidence linking football-related injuries to dementia. And in 2015, there was a movie that came out entitled Concussion, which starred Will Smith in the movie. And he was portraying Dr. Amulu's life, and he brought more attention to the research of CTE. And I have with me some pictures of Dr. Amulu. If you see here at the top right here is a picture of Dr. Amulu himself. And right here at the bottom, there's a picture of the star Will Smith of the movie Concussion, as well as Dr. Amulu posed with him in the picture as well. Also, the first CTE diagnosis in a post-mortem patient was an NFL player by the name of Mike Webster. He's posted right here in the middle. In 2002, Dr. Amulu studied the brain of this Hall of Fame Pittsburgh Steelers football player. And he studied it using a lot of different ways, numerous brain specimens, and to contact the sports athletes, finding extensive brain damage, tauopathy, as was mentioned by Mr. Meeks earlier. The doctors had estimated that he had been in an equivalent of 25,000 automobile crashes in over 25 years of playing football at high school, college, and at the professional level. So that is a lot of traumatic brain injuries and brain trauma there within 25 years of playing football altogether. So now we see why the sad case that Mike Webster died of a heart attack in 2002 at the tender age of 50 years old. Also, there's a high-profile case of another football player. His name was Aaron Hernandez. He is right here at the bottom right here, bottom left. Hernandez, he was once a promising tight end with the New England Patriots, but he was convicted of doing a shocking murder in 2017. And it shocked the world because he was not known at the time by the public of being such a person. And in 2017, once he was convicted there, he committed suicide at the tender age of 27. Well, the Boston University, Dr. Ann McKee, the director there at the CTE Center, said that Mr. Hernandez had a stage 3 CTE. Now, there's only 4 stages of CTE. And at the age of 27, he had a CTE of 3. And she said that people who are 46 years old and older ones are the ones that usually have the stages of 3 and 4 CTE. And if you see here at the bottom right here, there's a picture of a normal 27-year-old's brain. And you can see here the ventricular enlargement here is very small with the normal brain. But to the right of that, there's Aaron Hernandez's brain. And you can see the ventricular enlargement is very wide, is very large. So you can see the difference there of him having such a big, large enlargement of the brain tissue there. So what about safety issues? How can, in today's society of sports, whether it's hockey or baseball or football, how can they protect themselves, at least more so against CTE? Well, the NFL has put, in other contact sports, have put together some helmet-to-helmet penalties and rules and fines to protect the players. So anytime they get into a collision, the player is fined or ejected from the game. And what about any other things that protects different people from neurological brain damage? Well, a neurologist named Robert Knight, Dr. Robert Knight, a professor at Cal U Berkeley University, invented a helmet. He called it the Brain Guard, and it's right here at the top here. It's a Brain Guard helmet here. And what it does is effectively pad it and dampen, and it affects the direct blows and it lessens them. And he said, more importantly, the innovative outer shell rotates to absorb the twisting forces of today's helmets that they don't protect from that as well. And it's essentially a helmet within a helmet. So it really helps to guard against some of these hard blows that some of these injuries, some of these other helmets don't have. And the Brain Guard line includes helmets from, as I mentioned, baseball, bicycling, and hockey. But also they have prototypes for the military, firefighters, and construction workers. So in conclusion today, even with all of today's technology and advances, there is still no definitive way to diagnose a patient with CTE until they have died. So let us all try to do our part in trying to be as safe as possible, not to disrupt our fragile brain, as science continues to strive to unravel the intriguing mystery of CTE. Thank you. My name is Tavia Stargell, and this is
Jeff Meeks. Thanks for watching, and go Bolts.